Good morning, everybody, and thank you for attending our COVID-19 video conference this morning. Today, we have the residents of Hillsborough County Nursing Home with us, as well as their staff nurse to help answer any questions you guys may have.
What is COVID-19?
COVID-19 is an infectious disease caused by a new strain of the coronavirus SARS-CoV-2, or a severe acute respiratory syndrome. The outbreak of the COVID-19 started in Wuhan, China, and spread all around the world, causing a global pandemic.
And how is it spread?
COVID-19 is going to spread from person to person through respiratory droplets produced when an infected person sneezes or coughs and another susceptible host inhales those particles. The virus can also spread when people touch contaminated surfaces and then touch their ears, face, or mouth.
Okay, how does it affect us?
So older adults are more likely to be infected. So there's a high chance that you guys will be more likely to be affected. And then vulnerable population for this COVID-19 is elders over 60 years old. Those have pre-existing chronic health conditions such as diabetics, lung cancer, and immunocompromised people. So, and there's no vaccine or medication to cure this virus.
And do you have any proof of this?
Yes, so according to the CDC, 8 out of 10 deaths reported in the US have been in older adults over the age of 65. In the table here, we have adults 65 to 84, as well as adults 85 and older, their hospitalization, as well as admission to the intensive care and death percentages that we have from our local hospitals.
Okay, so what are the signs and symptoms of this?
The symptoms that we should be looking out for are going to be fever, cough, shortness or difficulty breathing, chills, muscle pain, headache, sore throat, and new loss of taste or smell.
And when should I see the doctor?
You should see the doctor if you have bluish lips or face, persistent panting or pressure in the chest cavity, trouble breathing, or new confusion or inability to arouse. Mind you, these symptoms may take 2 to 14 days to appear after exposure to the COVID-19.
And how are COVID-19 and the flu different?
So COVID is caused by one virus, SARS-CoV-2, whereas the flu can be caused by multiple strands of the influenza virus. Symptoms of COVID-19 will typically occur within 1 to 4 days, and the symptoms for the flu can take up to 14 days. Antiviral medications and vaccines for COVID-19 are still under testing, therefore that's why the virus seems to be more deadly, and there are multiple antiviral medications and vaccines to help prevent the flu.
And what are the preventive measures?
So the best thing for you guys to do is to make sure you wash your hands frequently. This is going to help kill any bacteria or viruses that may be on your hands. Using an alcohol-based rub such as hand sanitizer or just regular soap and water is going to be your best bet. And also avoid touching your face. Your hands may touch surfaces that are contaminated and may carry the virus. If you don't touch your face, it'll limit the contact with your mucous membranes.
You also have to maintain social distancing. This is where you have to be at least 3 feet apart from another person to lower the risk of inhaling unwanted droplets from others. You also have to practice respiratory hygiene. This is where you're going to cover your mouth and nose with a tissue or an elbow when coughing or sneezing to limit the spread of the virus.
So is that why my kids are see me now?
Yes, it is one of the reasons. So social distance results in decrease of the transmission rate of COVID-19. So it is one of the reasons they're not coming to visit you.
Okay, and I have heard like if I expose myself to a temperature higher than 25 degrees Celsius, I won't get coronavirus. Is that true?
No, it's not true. It's a completely false statement. No matter how sunny or how hot the weather is, anyone can get infected by COVID-19. So there are a lot of mythbusters going around. I have heard that drinking alcohol prevents coronavirus. It's absolutely wrong too. Drinking actually makes health conditions worse. So there's a high chance of getting infected with COVID-19 if you drink more alcohol. And there's also another mythbusters going around saying that if you hold your breath for like 10 seconds or more, you're COVID-free. It's absolutely wrong too. We have no evidence or we have no data to support these. So these things are wrong.
Some places where you can get some reliable information would be the CDC as well as the World Health Organization websites. These are going to give you the most up-to-date and reliable information that are coming from the government themselves. Thank you guys for attending this conference, and I hope to see that you all are practicing our preventative measures that we have shown you today.
Okay, thank you.
Thank you.
Bye.
Bye.